Breast cancer is not yet considered preventable. Most of the data that are being looked at involve nutrition, controlling weight, estrogen exposure. The most important thing about breast cancer is not trying to prevent it, although we're working on that. It's making sure we catch it early when it is most curable. The standard right now is a professional examination and mammograms. The bodies that give recommendations have sort of taken the pressure off of women by not suggesting that they do self-breast exams. I'm certainly not going to pressure women to have it, but I do think it's important that they get to know what their breasts feel like so that there's a change, they can bring it to attention. 85% of breast cancers are picked up on mammogram, but 15% of cancers will not show up on a mammogram, and so it's very important to have a professional examination. And if you feel comfortable doing self-breast exams, I don't think that there's anything wrong with that, and I would encourage it. As far as when you should have a mammogram, that's come under some debate recently. The standard recommendations from the American Cancer Society and the American College of Surgeons are annual mammograms beginning at age 40. Unless you have a family history of early breast cancer in your family, then they should start 10 years younger than the youngest member in the family that has had breast cancer. The newer recommendations from one of the government groups has sort of changed to not doing routine mammograms until age 50 and then doing them every couple of years. That data is still out on whether or not that's going to prove to be as good as annual breast exams and annual mammograms.